Good afternoon, everyone. Thank you for joining us here online. We should be beginning shortly.
Call her and tell her. Good afternoon. Hi, Auntie Leela. How are you? She can't.
Hi, Sonia. Can you please begin this meeting?
Good afternoon, everyone. A very, very warm welcome to our special guests here today. May I request everyone to mute themselves, please? Shalom, would it be possible to mute everyone who are our online guests? Thank you. Good afternoon, everyone. A very, very warm welcome to our special guest today, our online viewers on Zoom as well as on YouTube, our frontline warriors, the doctors, nurses, aspiring medical professionals, students, as well as friends of Mukul Madhav Foundation. I am Sonia Rao, a well-wisher and friend of Mukul Madhav Foundation, and I'm very happy to be hosting this webinar on this virtual platform. Welcome to this interesting subject which is many a times forgotten, yet is a very powerful profession. A profession which is at the very heart of healthcare. And today's webinar focuses on this subject. Nursing, a noble profession, brought to you by Mukul Madhav Foundation. We have with us today an eminent panelist of speakers with rich experience and expertise in their field of work. We are happy to welcome Dr. Arvind Shah, Dr. Deepak Ugra, and Nurse Suzanne from NHS Trust London. With us here today is another special guest and dear to the city of Pune, Mrs. Leela Punawala. Welcome, Mrs. Punawala. To start today's proceedings, a brief overview of Mukul Madhav Foundation. MMF, as it's known to many of us, was established in 1999 as a public charitable trust. They have been instrumental in providing assistance in the field of healthcare, education, social welfare, rural development, sanitation, and women empowerment to the economically and socially underprivileged sections of society. Their strong vision and determination to help the society has led them to touch thousands of lives over the years and spread infinite smiles. I would now like to call upon Mrs. Punawala to address the online audience. Before I call upon her, I would like to introduce this dynamic lady, a lady who established the Leela Punawala Foundation 25 years ago, is the recipient of the illustrious Padma Shri Award in 1989. Leela Punawala Foundation works towards the cause of promoting girls' education and women empowerment by offering merit cum need-based scholarships and skill-building programs. Since its inception, and with the motto of leading Indian ladies ahead, Leela Punawala Foundation has transformed the lives of 9,000 girls and touched upon 65,000 families, and has truly empowered them to move ahead and stand on their own feet. Over to you, Mrs. Leela Punawala.
Unmute. Good evening, everybody. I'm very pleased to be addressing all you girls. Some of you are still studying nursing and some of you may have finished. And also I'm very pleased to meet Dr. What was his name? Dr. Arvind Shah. I was searching for you where you were. Namaste ji. It's very nice to be present here because it's your talk that is going to affect these girls much more than any other. I may be saying to them that, okay, we thought, see, we didn't start with nursing. We started our scholarships with post-graduation, then engineering. But as I went along, I realized that this is a very important profession. And the girls who are really wanting to become nurses are those girls who really want to serve the society and yet sometimes don't have the means to qualify themselves. It was this main reason which made me want to support the girls who wanted to serve the society, the community. And what is interesting is to note that, you know, when you enter the nursing, after you get your scholarship or your own, the first function that takes place in your college is the candle lighting function. Am I right, girls? Yeah, say yes. And in that candle lighting function, each one of you are made to take an oath, what is called the Florence Nightingale oath, yes? And you take an oath that you will be true to your profession, and it is the service to the community that is going to play a major role in your life. And I think today the time has come where, but for your services, the humanity would have been very much endangered. So the whole society, the communities are grateful to you that you have chosen to be a nurse. And it's a noble profession. It's a profession which probably the society has still not realized the importance of. And I think this COVID-19 is going to make them realize how important this function is, how important this profession is and how much it is needed, because it involves a lot of sacrifice. While it is a profession, it's okay, but it involves a lot of sacrifice. You have to work odd hours, you have to meet different customers. The clients can be nasty, the clients can be pleased, the clients, when they're unhappy, they really can get really very tough to deal with. But you, with a smile, are always looking after your customers, your clients, the people you serve. I have personal experience when I was once hospitalized due to jaundice. And believe me or not, as the time went by, I was there for almost 21 days in the hospital. Every morning when I woke up, I used to wait for my nurse to come. The doctor was not so important as the nurse was. She would come in with a stiff, nice white uniform. She would come with a smile and she would come and say, "Hello, Mrs. Punawala, how are you this morning?" That cheerful voice, the cheerful sound that the nurse brings in with her early in the morning when the patient wakes up, makes the day for the patient. And I think this is a very important role that you play, and it's very much needed. And my message to you is, please continue this profession. Take care of yourself in present situation. Take care of yourself. We all, the community in the society, should pray for you. Should pray for the front. You're frontline warriors now. The warriors who are defending India at the borderline with China, but you all are defending every day the people against the borderline of our COVID-19. So we count upon you, we count upon your service, and we are really very happy that we are able to do something for the girls who really want to desire to serve the communities. I wish you good luck, and good luck to this conference also. And Ritu, thank you very much for your support. Mukul Foundation has also been supporting us to in turn support the girls. So we are like in between, bringing Robin Hood, bringing from one end and giving it to the other end. And we are the Robin Hoods in between. Here are the haves and here are the have-nots, and we are in between to take and give each other. And that's the service we are providing. And thank you, Ritu. We really count on your support to support these girls.
Thank you, Mrs. Leela Punawala. As she rightly quoted, the angel of nursing, Florence Nightingale, she rightly had said, nursing is an art, and if it has to be made an art, it requires an exclusive devotion, as hard a preparation as any painter's or sculptor's work. Introducing another special angel here today with us is Dr. Arvind Shah. Dr. Arvind Shah, thank you for being on today's webinar. He is currently the strategic lead for South Asia at Royal College of Pediatrics and Child Health, along with being the honorary senior lecturer at UCLH London. He is also an associate professor of pediatrics at the St. George's University, Grenada. Thank you, Dr. Shah, and I'd like to take this opportunity to hand over this virtual platform to you to take ahead the proceedings.
Thank you very much, Sonia, and namaskar, everybody. It is true pleasure to be connected to Rituji Chapriya, MMA Foundation, and I say it's God's given gift. It has given me the opportunity to work closely, and my connection started 3 years ago when we started work on Satara, on children with cerebral palsy. It's also a pleasure, and I'm phenomenally impressed with the work she has done, non-medical, but brilliant work. Also, it's grateful to see you, Leena Tai, and lovely to be connected for what work you're doing for nurses and women's rights. That's brilliant. Ladies, I see more than 100 ladies here, so I'm going to say in Marathi, Mi Takarizai, near Karad, near Kirloskawadi. That's where I was born. And my father, and I'm very grateful to Rituji because I was born in Satara district. And cerebral palsy was a काम करायचंय. I said, yes, I will be, because that's what that's where I was born and that's where I come from. So I'm going to tell you my little story. My father was a grain merchant in small village Takari, and he was the only one who had a car. in the house. And anybody unwell, they will come to say, Shetji, Mada mulga bara nahi, maji mulgi bari nahi. So he will take them either to Kirloskirwadi or Karad. I'm sure you're aware of those little towns. And that inspired me to take further my career in pediatrics. Unfortunately, he's not there. My mom is still alive back home, and my family is still in Dhaka. And I made my way to England. I'm now been here in England for just under 40 years. And I had privilege of working in this part of the world, which is phenomenal. And I was lead clinician in North Middlesex Hospital for a number of times. And one of the important things which I've learned about is my unit was successful because we respected nurses. Nurses were counted as consultants. Their opinion was vital. Patient care, a child care was not complete without nurses' input. And hence, everybody is in England are envy of our unit. And I think I'm very blessed to have Susan here, who is one of the leading educator in my unit. And I'm thankful for Susan for giving us the time. She just finished one meeting and joined us. So may I have second slide, please? And hence the point I'm making is nurses are important for this teamwork. To give a successful treatment to your patient, you want to have a nurse on board. And you heard from Madam Leela Punawala that how pleased she was to see a nurse in a white clothes and the pleasure that gave. And it's the empathy, the pleasure is very important part of treatment, not just the medicine. Next slide, please. My important message for you is nursing is a noble profession. It is vital that we treat it honestly. I always talk to my medical staff, my junior staff, your record should be honest, it should be clear. And honesty is an integral part of nursing and doctoring. And that's why we are noble. So that is my important message to you. And I'm sure this is the values your parents would like to aspire to. Next slide, please. Dignity and respect is very vital. And it is important that you treat the disabled child with equal respect. You treat the old person with equal respect, and also make sure they get proper lunch and dinner, and that's the part of it. And like treat him as like Atithi. And I think dignity and respect is part, and that's why I like nursing, because those are the core values in our heart. You want to do something for our patient. Next slide, please. Ethics, very important. It's a big word, and I'm not really giving true justice to that word, but I'm going to give a little example about this. Is that besides honesty, you need to follow ethics when you're doing nursing profession. And I'll give the example, like suppose by mistake, you're given a wrong drug or given a wrong dose of drug to a child or to an adult. It is important that you say to your seniors that this has happened. And you write down clearly and go and apologize your patient or child or parents. And Susan will talk about that. Is one of the work Susan has done massively on drug error. Drug errors are very common, but we need to be honest about it. And I think, and what parents want is no other person should be harmed by similar error. And what parents want is this nurse or this doctor is honest. And that's what is part of the ethics. I want you to take that message home. Next slide, please. Equality, diversity is an important thing. It is an inclusion. My daughter Ira did this slide, so she added inclusion that. So it is important that we treat different religion, caste, gender, age with respect and dignity, and treat them in the same footing. And I'm very proud to be Indian because my next door neighbor was Muslim. And whenever I used to come back from Pune from my school, I will go to Amma first and she'll give me a cup of tea. And then I will go to my home. So that is really practicing equality and diversity, respecting every religion, every caste religion, and also disability. So, and that is what I want you to think about when you're nursing, when you take the nursing profession on. Next slide. Also, I want to say that I think Susan will tell you about, and during COVID, lots of Indian nurses and Philippine nurses were in frontline, and we guys are very gentle. We never say no for things. If you're put in frontline, we'll say, this is my duty, I must do that. But it is important that at this early juncture, you also need to understand your rights. And also, there's nothing wrong about questioning a doctor if he has written something wrong, in a diplomatic way, in a polite way. And that's where we need to be stronger. And the aim of all that is to give better care for your patient. So please stand up for your rights and do right thing. Next slide. Thank you, Sonia. You mentioned about, and Alina, madam, you mentioned about Florence Nightingale, and this is what I want all those 100, 200 nurses who are student nurses are on webinar. I want you to be Florence Nightingale. This is the lady who has got a lamp in her hand, and she is the one who did look after wounded soldiers, with the lamp going around supporting them. And she was a British nurse, she was social reformer, and she was statistician. And one important message is, take home work for you, go and look at autobiography of Florence Nightingale. Thank you so much.
Thank you, Dr. Arvind Ji. Would you like to introduce our next panelist of speakers?
Definitely. So it's my tremendous pleasure to introduce Suzanne McFarlane. And I think you could see how we are sitting. We nurse and doctor work together. Currently working as pediatric practice developmental nurse lead, and she's qualified registered general nurse and also sick children nurse. She's also done MA in practice education. She's qualified in 1998 and consolidating for 3 years of gained experience, both in adult and also in pediatric nurses. She was phenomenal during COVID. She was thrown in deep end and she never flustered. So shows her resistance and resilience and confidence in supporting for patient care. So Suzanne McFarlane.
Hello, hi. Probably I should
Hello, good. Great to have you here with us. Thank you so much for sparing your valuable time.
Thank you. It's a pleasure to be here. As Dr. Shah introduced myself in a very kind manner. My name is Suzanne McFarlane, and my current role at the moment is that I work as a pediatric practice development nurse. Basically, that means that I train up staff in the clinical practice to ensure that they've got the right skills to be able to give safe care to all our patients. So obviously I've been asked by Dr. Shah to do this little talk. And even though I find this quite nerve-wracking, I couldn't say no because Dr. Shah is so instrumental in all our lives here as nurses. Because you're always supporting us, and it's true. And you're a champion and advocator for nurses. So I'm very pleased to be here to help out.
Thank you.
Okay, so I just wanted to talk about nursing being a noble profession, and what does noble means? It's all the things that we do, and we don't not think too much about getting paid. It's thinking about working 24 hours, providing care 24/7, going that extra mile, making sure that you're always giving, you're always caring. It's so compassionate because it's so important for this role. I think that's why it's noble. It's actually ranked the highest in honesty and ethics, and you actually talked about ethics. Also, I just thought, so this is just a snapshot of what I'm going to talk about, really, my personal experience, what I found positive and some of the things that I found probably negative. I just thought it's nice to kind of talk about the principles and the values, which is part of our nursing competencies. I think it's nice to look at all the options and pathways there are, so you don't think about getting into nursing and then that's it. There's so many opportunities. Also, just to summarize what the competencies are and how they underpin the core values. And finally, I'd like to talk a little bit about my COVID experience. Okay, next slide, is that okay? So, okay, I've trained here in the UK. I wasn't born here, but I was trained here. And it's, you know, the reason why I trained here is because obviously one has their own reason as to where they want to train and why. And so I always wanted to be a nurse, and I thought, you know, I'd like some massive, great opportunities. So I came to England only because my aunt lives here and she's a nurse, and you know, she's always encouraged me. So hence the reason I ended up in the UK training to be a nurse. So I became a general nurse, and following that, I did my children's nursing. Then I became a name nurse for child protection. This is a way of understanding not only the clinical side of things, but also safeguarding and the social aspect of nursing. And then I did my master's in practice education, because I've always wanted to pass, you know, I suppose to nurture and to support junior staff and students, because I just think it's such a fantastic profession. And I've been doing it for 20 odd years and I still enjoy it and I'm still here. Nursing has really helped me to adapt. I think it's just incredible, really. So just to go through some benefits of nursing, what I found quite a positive thing in doing nursing, you instantly become teachers, even second year. So you start your first year. As a second year, you teach your first year. You're also teaching your colleagues. You're teaching the parents, and you're teaching their patients, because they're always asking, you know, when the doctors come around and do their ward round, you know, a lot of the times from experience, they don't understand a lot of things that the doctors would say, maybe because of the terminology that they've used, and it's always the nurses there trying to explain. So little things like how to take your medication, when to take your medication, how to use your inhaler, you know, that do require a lot of skills and patience. And you need to say that in such a way that the patients understand, and which they do. That's why they're constantly asking the nurses, how do you do this, or how do you do that? And you become advocates as well, because, which I find fascinating. I love getting to know about people. And, you know, when they admit you on the ward, you know, part of our role is to ask them all these questions in order to get a good understanding of what they are, how they feel. And this is really, really important, because they can call on you anytime. And the idea is that they need to have positive experience in hospitals. From a clinical point of view, we are the advocate in terms of they becoming unwell. We're constantly monitoring them, so we can keep an eye on the red flags and escalate as and when needed. With nursing, you are constantly learning something new. And as I said, I've been doing nursing for 22 years, and I'm still here because it's not, you know, it's not a boring profession. It's not, you know, there's just so much to learn, and I'm actually still learning after 22 years. It's such, nursing is so high in demand in the world, really. So everywhere you go, you know, you're sure to get a job, really. We've got, isn't it, a North Middlesex hospital. We've got so many nurses. We've got from the Philippines, we've got from India, we've got, I mean, it's from Europe, everywhere, really. And I find that really, really fascinating. There's so many opportunities which I'll talk about. As a nurse, I found it was brilliant to be critical thinkers, because you don't assume. We are always, you know, we don't accept assumption. So we always questioning ideas to make sure that we know what sort of information we're giving to our patients. We can become innovators. I think this is brilliant because it helps you to think about risk. So if you're in a clinical setting and there is any sort of risk in terms of, I'm just trying to think of an example. So like when you said about medication, yeah. So all our nurses have to pass a drug calculation test, and what has happened is that it's a very standard competency and a standard way of learning. So me, with my educator's hat, I started to think in a more innovative way that, okay, how can I get all these different nurses to pass their maths exams? Because the idea is because they all think differently. So I've introduced different ways of teaching. So I don't just have like a question and then you do it. I just make it a little bit more fun and make sure that I've got a drug chart and I just make it a little bit more like an OSCE, if you like. So, and it's worked. So it's always about thinking how to make things better. I think with nursing as well, you transforms life. If someone asks you, what do you do? And I say I'm a nurse, it's always that, oh my God, that's amazing. But it's not only about that feedback, but it's also about, from a patient's perspective, how they look up to us and how, they'll explain how we've made their journey in hospital and how they felt whilst they were admitted. And it's such an honourable, honestly, as I said, I'm still nursing and I absolutely love it, especially around the emotional support. And a lot of families, their end of life, where clinical treatment is withdrawn, that's a big, that's so important. That for that person, all they need is your care. You need to be compassionate, make them feel comfortable, and it makes such a huge difference. And also with nursing, I mean, we are the highest workforce, really, healthcare. So next slide, please. So obviously, I've talked about all these wonderful and positive things about nursing. Obviously, there are constraints. I mean, personally, I felt, the difficult patients and difficult workers, co-workers, that can be an issue. But having said so, it's a development need. So as part of our nursing program, we've got different levels, and you have to demonstrate that you are able to communicate at that higher level and that difficult level. So even though I've put it up here as a constraint, it actually, we need this in order to help us to develop. It's a very physical, emotional, demanding job, when you're young, like when I was. I don't see myself as young anymore. I could do it, and I loved it. I loved that adrenaline rush. And obviously, you've got your own social hours. But as later on in the in my slides, or in my talk rather, this can easily be overcome because, as I said, there's so many different options, and you don't have to stay in a ward where you do long hours all the time. Thank you. Next slide, please. Thank you. So these are our core values. So nurses operate on 6 core values known as the 6 C's. So we call them care, compassion, competence, communication, courage, and commitment. And this is what underpins a nurse education. So a lot of basics there, as you can see. So I'll give you an example. A few years ago, we had a hospital that was performing really poorly, and so a big investigation was done. And the reason behind this hospital not performing well was because the basic of care, compassion wasn't followed through. So in 2012, they've reinvented the 6 C's to re-emphasize that actually this is the foundation. And if you can actually, if you actually implement these as part of your care, you will be fine when it comes to teamwork and leadership and patients having a positive experience. Next slide, please. So it's just giving you just a little examples of the 6 Sixes. So with care, all of the hospitals, this is core to their organization. It actually defines how we work. If you look up every trust, they all have, you look up at what their values are, you'll see something alongside care, being open and honest, honesty, integrity, all the basics. Compassion, again, we've talked about that so many times, Dr. Shah, you as well. This is how care is given through relationships, and we can't emphasize enough the relationship that we build with our parents, our patients, and obviously that means that it's showing huge compassion. Competence, so that's where my role is at the moment, is being able to ensure staff are able to give safe care, basically, and it's about supporting them, not only teaching them, but also working alongside them on the ward area. And it's about teaching clinical, it's also about the professional values as well. Communication, it's central to successful care and relationship and team working. And again, it's so important, that rapport with our patients. Courage is a huge thing, and especially for me, when I came, when I did my nursing here, I think for me, I had to build on that, because I just felt I wasn't courageous enough or wasn't assertive enough. But when you learn so much, you become courageous, and that was a huge development skill for me. So you need to speak up. So if you see poor care or anything that you're not comfortable with, it's really, really important to speak up, because at the end of the day, it's about patient safety, it's about your integrity, and it's about making sure there's no harm to patients. And finally, commitment. So obviously I've talked so much about all the positives, but think about the negatives. And it's such a fantastic profession that commitment is high on the agenda, because there are going to be a lot of challenges, but we need people like yourselves, like nurses, to actually keep this going. My next slide. So here, so I'm going to talk a little bit about the nursing principles. This is the Royal College of Nursing, our membership or union, really. There is about 450,000 nurses, midwives and students who are with the Royal College of Nursing, and they're there to support us as well in a lot of ways. They are our professional body, and they work around nursing standards, education and practices. So as you can see, it's the same scenario as with our core values. They talk about safe and effective care, about reflecting in our behavior, how we come across, again, treating everyone with dignity, humanity, and respecting everyone equally, as you said, Shah. Responsibility for care provided. So you're answerable to for your actions. So it's really up to you. It's your responsibility to make sure that you practice safe, that you keep learning. Because if you deliver care and it's shortfall, you are responsible. So you just put that onus on you to take responsibility. Managing risk, which I've talked about, always being vigilant about what needs to be improved and how you can improve that. Provide and promote care that puts people at the center. So, our patients at the center of their decision making. We don't make decisions for them. We get to know them. We speak to them. We find out about them, and we take into consideration what they want as part of their care. Really, really important. Next slide, please. We've talked about communication. So this is communication at a higher level, not only about rapport with your patients, but then you get to learn about, how to record treatment, how to evaluate, if there is, any kind of complaints, how you document. Here, we complete something called a day text. And the idea is not to get anyone into trouble, but it's to learn from it. And that's what we are good at, learning from our errors and our mistakes and not blaming anybody. Yeah. Always making sure we're up to date with our knowledge and skills. And that's what I love about nursing. So that's why you don't ever get bored. You're always learning. Teamwork, which you mentioned, so important. We not only work with the doctors, but we work with dietitians, we work with our physios, we work with the pharmacists. There's so many people that you work with, and it's so important to keep that going for the benefit of our patients. And finally, I just feel that it's so important to lead by example. So if we practice the principles and the core values, this is what we will be teaching our junior staff, and we want that message to pass on. Next slide, please. So I just want to talk about nursing in terms of how you can get into nursing. There are different ways. You don't have to go through the university route. Some people choose to do that, and that's fine. We've got apprenticeships. So again, so this is basically where you don't have so whoever wants to go into nursing, that worry too much about financial constraints, because it means that the trust pays for it, but you go through a slightly different program. But of course, at the end of the 5 years, you still become a qualified nurse. You've also got the nurse associate. This is fairly new here. And the reason why we've introduced it is because our role as nurses are becoming very technical and very complex. And what they were thinking is that, oh, if our nurses are, if this is happening, that means we're not spending enough time with our patients. Hence the reason for the nurse associate, because they'll have a lot of time to spend with our patients to make sure that they care and show that compassion towards them. So even though things are changing, it's still on the agenda that we can't lose these core values. We got conversion as well. So if you're an adult trained nurse, which I was, I wanted to do children, so then I did a conversion. And yeah, so it's the other way around. If you're children trained, you can convert to adults. But I think in the UK, I'll show you on my other slide what I've meant, and I'll explore a bit more about conversion. Post-graduation, so this means if you've done a degree, say in marketing or advertising, and you think, you know what, I really want to be a nurse now, I don't want to carry on with advertising or marketing, then you can. So you can do your nursing with your previous degree, and basically it's 18 months. There's so many options, which I think is fantastic because it just makes it accessible for all. My next slide, please. So here in the UK, you can go in, it's a pre-registration undergraduate course, and it's 3 years, and you can go in directly to do your mental health, your adult registered nurse, your sick children's nurse, or disability nurse. I think a lot of countries, and especially in Europe, we just do, what they've done is you become a general registered nurse, which means that you are able, when you qualify, and it's a 4-year degree, when you qualify, you can look after you can look after disabled children, you can look after sick children. So you are more, as I say, because it's general, you can do a bit of everything. But here in the UK, they kind of section it off. So you can go straight into these pathways, which I think makes it a little bit difficult sometimes, because things like, like when we had COVID, a lot of our children nurses did find it very difficult to adapt because they didn't have any general nurse skills, whereas I did my general nursing, so it didn't scare me at all. So I will recommend general nursing at all times, really. And then you can branch out if you want to learn anything different. So next slide, please.
Okay.
How am I with time?
You're fine, Suzanne. You can go on. You can
Okay.
finish your presentation.
Okay, so I wanted to talk a little about our Nurse Midwifery Council. They call us the NMC. So this is our governing body, and we've got, so they keep a register of all the qualified nurses. They're responsible for setting standards as well, which I talked about before, and also they set standards for training and patients. It's something that we have to abide by. We have to, the thing about the NMC is that every 3 years we need to revalidate. So we have to demonstrate that we worked so many hours over 3 years, that we've had some training, we've learned something new within nursing, that we've done some reflection, and that we've had some feedback from parents and from patients saying, oh, what a good nurse, you know, thank you so much, she's done so well because she was caring or she showed compassion. This is basically what our Nursing Midwifery Council, what the role is for us. Next slide, please. And so pulling through from the core values and our principles, this is what the competencies are for our nursing students. So there are 4 domains. So as you can see, the first 2, it's all about that basic, isn't it? Professional values, where you talk about the 6 C's, and communication and interpersonal skills. I mean, I find that quite fascinating. Yeah. Yeah, and it's part of the program. And then, you know, obviously you have to be good at your decision making and your leadership management and team working. But I just find, you know, looking at that slide, a lot of it is about the things that makes a difference to a patient's lives. Next slide, please. So I just thought it'd be nice just to go through each year what is covered. So you've got like year 1, you learn a little bit about your physiology, functions of the body, and you've got an 8-week placement there on how to deliver compassionate care, and that's in a clinical setting. And the students are supported through workshops and tutorials. I just find that fascinating that, you know, a whole block of it is about compassionate care. Then you have an assessment, which we do with them. And also in year 1, you learn a lot about personal development, about organization, management skills, reflection, communication, self-awareness. So you know, this is transferable. Yeah. And I think you can't get this really with a lot of other jobs. Absolutely. Next slide, please. Year 2, so then the students go out to the community. So they get, you know, in year 1, they understand, they have some sort of experience in the clinical hospital area. Then they go out to the community and they get to learn about infectious diseases and they learn about health promotion. And it's, again, transferable. So when you come back to the ward, you're able to give a lot of information about their health, you know, how to stay healthy, how to eat well, how to exercise, things like that. So you also in year 2, you learn to critically appraise, because in year 3, you have to do your own research paper on a topic that where there is a gap, basically. So you learn how to appraise. And, you know, it's earlier on when I talked all about risk and thinking about service improvements. How can I make this better? And year 3, next slide, please. So, yeah, and then you get on to the your leader, management coordinator role. So you get to manage the ward, you get to allocate nurses to your patients, thinking of skill mixes, and you are supported very well with the nurse in charge. With year 3, what is amazing now, which they've changed the program, you come out with skills as an educator and a supervisor. So before, like myself, after qualifying, this is additional skills I had to do. Now it's incorporated in the program. So you're coming out with skills where you already feel confident supporting your juniors, which I think that's amazing. And the rest of it, obviously, as a year 3 student, you do your dissertation on a research activity, and it's always on something. You choose a topic to improve the service, basically. So it's something that you eventually implement when you're employed as a staff nurse. Next slide, please. So just to go through nursing progression. So when you're qualified as a nurse, these are so many opportunities here. So we've got something called an ACP, which is Advanced Clinical Practitioner, and these are additional skills. So because we are so busy, and especially in this hospital, in other ways of cutting down the breaching times, so patients don't have to stay and wait in A&E or on the ward for a long time, we created these posts. So basically, the ACP can actually admit a patient, they can plan their treatment, and they can discharge them because they can prescribe, so they have those additional skills. We also have clinical nurse specialists. So, after you've done your general nursing and you feel like, you know what, I've got enough general experience, I like to specialize in something. This is what the clinical nurse specialist role does. So at the moment, we've got someone doing asthma, there's someone else doing oncology, allergy, and it's really good because it's very nurse-led. And you don't need to the doctors don't need to get involved. It's only as and when. You can go into research, you can go into education like I did. And I really like education is just not about teaching, but it's all about giving, supporting staff via clinical supervision. So they can come to you and talk about something that was really challenging. And, clinical supervision is about listening and exploring and actually helping them to come up with some decisions themselves. And for me as an educator, to identify other learning needs. You can stay in clinical, or you can go into management, which I used to be a ward manager for 2 wards. And I've learned so much, again, about management skills. But coupled with my education, I felt those 2 sets of skills worked really, really well, because I think sometimes in management, you can get managers who are very target driven, and that can cause problems as well, or challenges if you like. So I think with my education role, I was able to balance it really well. You can also go in the community. So we've got a team of community nurses where they go to the patient's own home and deliver treatment. So it reduces anxiety. And next slide, please. Is this my final slide? Yep. Am I talking too much?
No.
And so I just wanted to talk a little bit about my experience of COVID. So when COVID happened, all our pediatric services were reduced. And so suddenly we all needed to help the adult side. So I was involved in setting up a step-down ward for COVID patients. But initially it was really scary for everyone. And I think everybody's mental health was impacted. So now we're doing so much work for staff well-being, because it just had that psychological effect, not only because you had to go and work with adults, but also, initially we're short of PPE, and we were scared we were going to get COVID, we were going to die. It was just awful. But you know what, when you have your nursing hat, you don't think about things like that. So I just thought, okay, we need to help. All of us need to help. So I was quite pleased I was part of this journey. So we set this ward up. We couldn't get any healthcare assistant to help because they were all very scared. So we actually trained up a group of young university students who were studying something totally different. And so we trained them up, and we just went with it. And myself and the managers were just being very supportive and being there clinically. And honestly, it's just to see how these healthcare assistants have thrived and doing amazing. And half of them want to leave the degree that we're doing and wants to do nursing now. I find that really, really fascinating. So yeah, so that was my journey. I've learned a lot. I've learned to adapt. I've learned new skills. And I just found it quite positive because I felt I could use my skills to help others. And so COVID-19, even though it was really, really scary to start with, I think with my nursing hat, I just went with it. And I came out feeling a lot stronger. And so that's my experience with COVID-19. And so I just thought I'd like to end with Florence Nightingale. So Florence Nightingale gave dignity to the nursing profession during the Crimean War, which organized care for wounded soldiers. Today, Nightingales, meaning us nurses, are with us in our COVID-19 hospitals, saving lives. And I think she couldn't have put it any better. So that's me, thank you.
Thank you, Suzanne, for that wonderful presentation. And I'm sure you've touched a chord in many of our hearts with your session, which was enlightening, as well as teaching us about this profession and taking it ahead. What I loved is the 6 C's that you said. And out of those 6 C's, I have picked out 4 C's, which resonated with me, as well as our host organization for today, Mukul Madhav Foundation: care, compassion, competent, and commitment. Our hosts today, MMF, are the most committed setup and team, setting up and upgrading existing medical institutions, giving financial support to the lesser privileged for extensive medical treatment, promoting preventive health checkups, spreading awareness about hygiene and sanitation. With this in mind today, I think today's webinar has resonated with the ethos of being here on this platform to educate and empower the nurses as well as students who are studying to be nurses to be proud of being a part of such a caring, compassionate, and dignified profession. While you're doing that, spreading the core values and ethics of the medical and nursing fraternity. Thank you. And over to you, Dr. Arvind Shah, to introduce our next panelist.
Thank you so much. Susan is my Florence Nightingale. I'll tell you, it was hard during COVID and she was not flustered. There was a fear, but she went up front and supported. Rituji knows we lost so many patients here. We had 350 deaths in my hospital, but Susan was not flustered. So hats to her. What she speaks, she does more than that. So I'm very privileged to have you, Susan.
Thank you, and you. And thank you for having me.
No, you've been fantastic. So it's my great privilege to introduce my close friend and, of course, big boss, Dr. Ugra. He is honorary consultant pediatrician at Leela Hospital and also research and Hinduja Healthcare Surgeon. He was ex-president of Indian Academy of Pediatrics. And I work very closely with him because we do exams. We have 8 centers in India doing a master PCH exam, and he is the lead in coordinating that. And he was the founder, one of the steering founder of Royal College of Pediatric and Childhood Research REACH organization. And his worth of knowledge is phenomenal. Contribution to pediatrics is brilliant. So here to you, Dr. Deepak Ugra. Where are you?
Good evening, everybody, and thank you, Dr. Arvind. It was a wonderful talk by Suzanne and really informative. Thank you for that. Thank you, Rituji, also for coordinating for this webinar today. Thanks, everyone, for giving me the opportunity to be a part of this important webinar. Now, I'll just take a couple of minutes to share my feelings about the nursing care. And we are in the part of the world where, despite of having the norms which are lower than the international norms for the nurses to the patient ratio, India is still in shortage of about over 2 million nurses. So that's quite a lot. And it is our duty to understand the importance of the nursing care and see that how more and more people take up the nursing care and how they can make the patient care more useful, more positive. I was just going through, after Arvind spoke to me about this session and Fiji spoke to me about this session, I was going through the net and realized that over the last 3 or 4 years, the admission in the nursing college has gone down. When India is still in the shortage of nursing care and the nurses enrolled less in number, it's not a very good picture for India in the coming years. So we need to understand what may be the reason. First, for the lower enrollment in the nurses college. And second, that some of these young, very well trained, good, efficient nurses who try to go abroad. Initially, I thought maybe finances, but I made a point after I got this call from Arvind that I need to understand. I spoke to some of those young nurses in our own hospitals who are working with us, who are efficient, and I really pay attention to their inputs when I go for my rounds in the ward. There is always a junior doctor, a resident doctor who is accompanying us in the ward for the round. But it is very important. I always look at the nurse and ask, what is your feeling? What do you feel? Because it is the nurse who in the ward is spending more time with the patient, the relatives. And I'm very sure that at every round I get some important clue from the nurse. Their observation is so vital that I must confess here that sometimes we have saved a patient because of their input, because of their observation. So that's the most important thing that I follow right from day one of my practice. And it's now, this is the 30th year in pediatric practice of mine. So it's not a very short time, it's a reasonably good time. My feeling is that when I spoke to them, I realized it's not the financial reason that they are trying to go abroad. They feel that they can be involved a little more than what they are involved in the patient care. Their opinion should be given a little more important, little more weighted when it comes for the assessment of the patient. And I realized that when some of them said, sir, you are the only one who speak to us. You are the only one who asked, what do you feel, sister, about this patient? And we wish that others also give us the same importance and they speak the same thing to us. And it makes a lot of difference. And some of them have given such important feedback even in mid of night. And that has really helped me. So I think we need to look at on our side that how we give them more important, how we pay attention to their observation, to their inputs. I think that will make, and finally, the benefit is of the child who is unwell, who is in a hospital, the benefit is of the patient who is in a hospital. We must definitely try to do that. Secondly, I am not very well versed with the working condition of UK, but I myself feel that many of our nurses who are working in the hospital, tertiary level hospitals, both in private sector and public sector, end up spending a lot of time on making the records more than doing the clinical work. And I think if their involvement in doing the clinical work is improved, is increased, their interest in nursing care will increase. They are here because they always wanted to serve a ill person. Therefore, they are here. They are not here for money. There are other ways of making money. So if they're here because they wanted to contribute to the patient care, then let's give an opportunity to them to do some more clinical work than what we are doing. I think if we look at whichever angle, most important thing is that let us take care of the people who are taking care of the people. So if I take care of nurse, if I take care of the need of the nurses, then obviously they will take care of the patient. Finally, the patient may or may not remember that particular nurse who took care of the patient, but would remember that I went to this doctor in this hospital and I was taken care of. The team was fantastic. I like this statement, even Arvind, who said it is a team, it is not nurse, it is not doctor, it is not hospital. If any patient ever tells me, doctor, I went to that hospital, my experience wasn't good, I think don't blame the hospital. If somebody blames the doctor, they don't blame the doctor. It's a team. Each one of us, whether it's a doctor, it's a nurse, even attendant, even the equipment, the hospital, this makes a team. And all of us, if it work as a team, will definitely give more results. Now, I'm lucky that I'm involved as a COVID task force member of Leela Hospital. And I must say that the nurses and the junior doctors are the real frontline warrior. They have they've performed beyond the expectation. And I quoted that I salute every person, whether it's a nurse or a junior doctor. I salute every that person who has worn a PPE in last 6 months. It's a different kind of service, a different kind of atmosphere. And the person who can work for 6 hours at one stretch in PPE, I really salute that person. He or she deserve it. And I once again thanks Arvind. Thanks, Suzanne, for the wonderful talk. Thanks, Rituji, for organizing all this, and Mukund Foundation. Thank you very much.
Thank you, Dr. Ugra, for those words of wisdom and insights. We have some audience questions. So with the permission of the panelists, please may I go ahead, Dr. Arvind? Dr. Arvind, you're mute. You need to unmute yourself.
Yeah, apologies. Yeah, I'm here.
Thank you so much. With your permission, please may I go ahead with the Q&A session?
Please.
So
Delighted.
we have a question from Dr. Sharda Ramesh. She's the director of a well-known college here in India, the Symbiosis College of Nursing. Her question is, in the given pandemic and the kind of infection exposure to nurses, what would be the plight of students' input to nursing? Do you think parents with 1 or 2 children in a family will send their wards to practice nursing?
Very, very pertinent question, very relevant for this current situation. I think Susan, I'm going to ask Susan to say part of that. You want to repeat?
Yeah, can you repeat that question? I didn't quite understand it, sorry.
Sure. So the question is in 2 parts. The first part being, in the given pandemic situation and the kind of infection exposure to the nurses, what would the plight of students be considering this profession of nursing? Do you think parents with 1 or 2 children in their family will send their wards to practice this noble profession?
You want to talk about nursing, and I'll talk about infection to children. Yeah. Go ahead.
I mean, interesting question, isn't it? Well, I can just give an opinion. Obviously, I think what was scary is that there was a lot of deaths of some of our nurses from the BAME community.
British Asian Black community, the ethnic minority. Yeah.
And I think this has scared a lot of people, but I think they are doing a lot of research to find out why. So it'd be interesting when we get that feedback as to why. But I think there are some theories around, you know, COVID was a challenge and it was life-changing. And I think if young people want to make a difference, you know, young people are just, you know, fearless, aren't they? And I think, you know, if you follow the guidelines, which I did, I was really, really scared, but I made sure I wore my PPE. I made sure I washed my hands all the time. And I made sure, because I'm asthmatic, so that responsibility not to look after children who had who I needed to suction or worked in theatre, where you put yourself more at risk. So, you know, I'm fine, and I'm just thinking it's about taking responsibility, following process, and also about I think more so young people want to make a difference, and I think that supersedes everything. So that's my feedback. And also, may I add, we've had an increase in our application to all the universities. So it's gone, we've got so many young people wanting to enter the profession. So we actually haven't deterred them.
Yeah. Can I answer the bit about what Susan said?
Yes, Dr. Arvind, please go ahead.
There's a fear, but if you use correct PPE, and you're young, the chance of you catching infection is different. It's very, very low. And the gratitude you get saving somebody's life is phenomenal. And that's why we've seen rise in application of nursing professionally here. Secondly, transmission of infection to your young ones in the home. What she said, 2 children at home will you send? The infection to the children, there's a lot of work going on in St. George's, research going on about transmission of infection from healthcare worker to children. The infection rate is very minimal, and the infection in children is extremely mild. The child getting a nasty infection is less than a child getting struck out by lightning. So it's a very, very minimal infection. So that worry should not be an issue. And in fact, those who were healthcare professional nurses, they found that the infection rate was lower. Of course, there are some prototypes, like if you're overweight, you're diabetic, you're at high risk. And that risk assessment needs to be done. If a nurse is overweight and diabetic and which we're doing now, then they should not be in front line. But those who are in normal, healthy, then there should not be any fear about that, really. I hope it answers it.
Deepak, can I add something here?
Yeah, Deepak.
Dr. Deepak, can I say something?
Sure, doctor, please go ahead.
Fine. I fully agree with Dr. Arvind. If I look at last 6 months of my experience with COVID, forget about the nurses, doctors, overall, we haven't yet admitted any child less than 10 years with a COVID positive report. Everybody got all right at home. We had only one child who went into severe COVID. He was 14-year-old. So as Arvind said, the younger the age, they are protected. They are not having severe disease, and overall incidence is also less. Second thing, I myself feel that I must say that I've learned a lot in last 5 or 6 months. I find myself the privileged one, the lucky one, that I'm going through this pandemic as a healthcare worker, whether I'm a doctor or a nurse. It is a tremendous opportunity for each one of us to learn. There are very few lucky people. If I go back in last 3 generations, nobody has seen this kind of pandemic. So I am that lucky one who got this opportunity. Let me make the best of it. Let me learn the things which I would have never learned in my life. I think this is what I speak to my junior and my nurses, and they're all enthusiastic to contribute. They do the duty so well. All of them are performing exceptionally well.
I think, and the interesting part is COVID has united people. Nurses,
yes, absolutely.
Scientists, everybody's fighting for finding new drugs. Everybody's sharing the genome. Everybody's fighting for new vaccine. And the world has become smaller. Everyone wants to share everybody's experience. And I've never attended so many webinars in my life than what I've done over the last 4 or 5 months. She was part of one of the webinars when she talked about children and new normal. So I think we are blessed with COVID, I would say. And this is Jain festival, so I'm going to change Michame Dokurum to COVID. If I heard it. Okay.
Thank you, doctor. Thank you, Suzanne. Thank you, Dr. Ugra, for that reassuring response to our young professionals. I have a question for Dr. Ugra. What do you consider to be your biggest professional achievement?
My biggest professional achievement is that I am satisfied that I could contribute during COVID-19. Initially, I was seeing patients, but then there was a policy that if I'm not a chest physician and if I'm above 55 years, then I am not directly involved with care of COVID-19. I found an alternative way, and I'm now involved with the task force and admin post. I'm contributing, and this time, the last 6 months has been the most satisfying time of my whole career as a pediatrician. And when I see a COVID positive child becoming all right and is turning COVID negative, I think there's a lot of satisfaction. As a doctor, even if you save one life, I mean, it gives you a lot of satisfaction. That is what we earn.
Yes, indeed, Dr. Ugra. In fact, children play and have superheroes in their life. But to us citizens, I think all the doctors and the nursing fraternity are our superheroes, and a big salute to you all. Moving ahead, Suzanne, there's a question for you here. Tell me, how do you organize, plan, and prioritize your work?
Sorry, someone is at the door. 1 second. Sorry, can you repeat that? Sorry.
No problem. Yeah, we could do that. I said, would you like to share with us, how do you organize, plan, and prioritize your work?
Gosh, that's one of the biggest challenges, actually. I probably work at home, but I won't advocate it. No, I think because I really enjoy what I do, I think even if I do spend some time at work to do catch up, it doesn't affect me because I'm very passionate at what I do. I obviously prioritize so at the moment we've got like an inspection coming. So obviously my priority at the moment is to make sure that all our nurses are up to date with their skills. And I'm doing one-to-ones with them, and we're setting time scales. And what it does, not only arrange to make sure that their skills are up to date, but also I get the opportunity to work with them. So it's achieving a lot more than just teaching. As I say, I don't know if I've answered that question, but I absolutely love what I do, and I've always been focused, and I love my time scales. And if I can't do something, if I think something is really challenging, I ask for help. I escalate, and it all comes together.
So the key is about loving what you do and doing it with passion, and the rest follows.
Absolutely.
Absolutely.
Dr. Shah, I have a question for you. Could you share an experience you had in dealing with a difficult person, and how you handled this situation?
I think that's very interesting, and I think difficult colleague, difficult doctor. I think it is important to dissect it out in details. Person may be in difficulty because of some reason beyond the work. It could well be financial difficulty, it may be family difficulties, could well be, and person may be struggling. And it may be that what he's showing difficulties by asking for help. So to understand and not to undermine the person in difficulty, to try and understand, dissect it out, and sit down and have a good chat on a coffee or tea, saying what the issues are. We're finding it that the job you're doing is not, so how can we help? And many times they're asking for that help. And going on and offering help, you could help that person to come out of their difficulty. And you can't just start saying, oh, he is a kind of person, just. So it's very vital to understand them and to support them. And you will see, and over my 20, 30 years of career, I've seen so many junior doctors and other professional and senior doctors in difficulty. And it makes hell of a lot of difference to have heart-to-heart, one-to-one conversation, understanding where it is coming from and how we can help. And I don't want to go further more, but we have scenario where the person was into the state of committing suicide, and that conversation turned the whole thing around. So it is very vital that you understand the other person, why is in that difficulty, and how I can help. So do understand their perspective, not jump into conclusion. I hope I've answered that.
I have a question for Dr. Ugra. Nurses are looked down at times, and a doctor gets more priority or importance in the Indian context. Let me put it that. Dr. Ugra, would you like to throw some light on how do you propose that we can bridge this gap to change and to have a different mindset in our minds?
Yeah, I agree with you, but the scenario in India is different. See, if you look at the overall healthcare in India, you can have a different kind of healthcare in metro, which is a small town. You can have a different kind of healthcare and a relationship between doctor and nurses at a private versus public sector. Private sector is still much better place where the bridge, the gap between the doctor and the nurses is narrow as compared to the government sector. And in metro is much narrower as compared to a smaller city. I think each doctor, each one of us has to understand what every one of us feel, that the patient care is a team performance, is a team approach. Each member of the team is important. I think UK and India both are very fond of cricket. And each player in those 11 has a role, a very specific role to play. Similarly, in patient care, the nurse, the doctor, everybody has a role to play. The doctor knows, as a consultant, I know that I would be spending 15 to 30 minutes with the patient when I go for my round. But I also know a nurse who has done 8 hours duty has spent 8 hours with that patient and would definitely have more information about patient than myself. It is better to spend 2-3 minutes out of my 15 minutes to hear her out, to listen to her, to see what she has to say, then check the notes, talk to the RMO, resident medical officer, and see how the collective information can help taking care of the patient. I think listening to the nurse is most important part of narrowing down the bridge between the doctors and the nurse.
Thank you, Dr. Ugra, for that. At this point, I'd like to ask if there are any audience questions. If you could please put up your hand so that we can address those questions and our panelists can respond. Any audience questions? Shalom, could you just quickly check and scroll down if there are any audience questions before we go to the next section of this program?
I cannot see any hands, Sonia.
Okay, so if any of you have any questions, please feel free to write them in the chat box and we'll come back to them. Taking this proceedings ahead of today's function, could we have a short video, please, Shalom?
Hi, Leela. How are you? Good, good. I can't see you. You know then.
Yes, in a moment.
This is the time to do it. COVID-19 taught us. You are.
Shalom, are we done with the video?
Yes, yes.
Thank you so much for that. Thank you to our eminent panelists for coming here and moving ahead. I take this opportunity to introduce the wind beneath the wings of Mukul Madhav Foundation, a lady who silently works behind the scenes to uplift lives and bring smiles. Managing Trustee of Mukul Madhav Foundation, Mrs. Ritu Prakash Chabria. Over to you, Mrs. Chabria, to propose the closing remarks for today.
Good evening, I should say. Thank you very, very much, Sonia, for that introduction. And I would like to take this opportunity to say a big thank you to our eminent panelists over here, Dr. Shah, Suzanne, and Dr. Ugra. I think this would not have been possible without your quick acceptance that we have had done. And a big thank you to Mrs. Punawala for being with us today. She has been really with supporting nursing as well as being an eminent member of our society in Pune. I'm very honored that she gave us her few moments on this platform. I would like to take this opportunity also to say a big thank you to the frontline warriors who are, some of them are here with us in this on this platform, and the ASHA workers, the A&M nurses, and students who are into nursing at this moment. I think you are very lucky. You are lucky to be in this noble profession. As Suzanne said very very sort of in a nutshell, what I understood is that there are so many different opportunities. And for her, she's proved it to us that 22 years that she has been serving, she's still not bored. So naturally, there is a lot to look forward. And I think there are many dimensions that one can pick up from nursing, from whether you want to be an educator, whether you want to practice. And the way you take this profession, I think, is literally in your hands. But it needs to be having something called dedication. Dedication to be able to take this to a different level. As Dr. Ugra said very, very clearly, that his satisfaction has been this point of his life where he has been serving COVID patients and seeing, I mean, I think the satisfaction that he's gained throughout the last 6 months of seeing, and he has also saluted those who have been wearing PPE suits and functioning for 6 hours. It's not easy. So, you know, a great big salute to all those who are in this profession, who are happy to be in this profession. And I would just request you to remain in this profession and encourage more and more. There is a big gap that we see in our country, and we really need to fulfill that. So looking forward to more joining this, and united we stand, as the saying says, united we stand, and we need to fight this war at the moment. But there is so much of dignity of being in this profession that I wish that you know, we could help more through Mukul Madhav Foundation, and see how we can get grassroots ASHA workers, A&M nurses to be much more sort of educated on a monthly basis, as well as give them more and more opportunities. So rural and urban nursing teams, a great big salute to you from Mukul Madhav Foundation. And thank you for this platform. Thank you for being with us. We are going to be planning many more webinars. So we will be in touch with you, and do sort of keep an eye on what we are doing at Mukul Madhav Foundation. And if we can be of any help, assistance during this time, please do not hesitate to get in touch with us. Thank you very much. And a big thank you to my friend Sonia.
Thank you, Mrs. Ritu Prakash Chabria, for those lovely words. It was my pleasure to be here on this platform. With this, I would like to close today's webinar with a parting statement, which is very apt for all of us today here on this online platform. When you're a nurse, you are every day touching lives, or a life will touch yours. May we all be blessed with the joy of life. Stay safe and have a great evening ahead of you. Thank you.
Thank you. Thank you
Thank
very
you.
much.
Thank you very much.